So back to the anatomical position. The first thing to remark about this image is we're also looking again here at 3 dimensions, and I'm going to try to explain some of the jargon terms that I mentioned already and will come up as we keep going. But unfortunately there will be more jargons, so please do pay attention. Now if we take a look first of all at the left hand side of this figure, you can see that there is a superior versus inferior dimension, and in the case of superior we're referring to the top of the organ, or in this case the body. The inferior position is simply the lower portion of the body. Superior can be thought of as from a high position, and sometimes it's referred to as cranial. So this is another jargon, and the reason we use jargon here is because we want to be able to distinguish the degree of superior position or high position, and we want to differentiate that from the lower position in terms of dimensions that I'll come to in a moment. So we've got cranial for superior, we've got caudal for inferior, that is from a low position. Now if we were to imagine the body in terms of the medial line, we would see that there is a left-hand side and a right-hand side. So let's imagine we had a small brain inside here. This is the right hemisphere and this is the left hemisphere, because this is the right hand and this is the left hand. And within each of these hemispheres we have a number of structures which in fact are almost identical on both sides. So right hemisphere and left hemisphere structures are very similar. But there are some different functions associated with the right and left hemispheres. So in the case of describing within each hemisphere the structures that we are interested in, we use 2 different terms. We use lateral and we use medial. Now, medial, you can see here, is any structure that is close to the midline. So all structures that are away from the midline are lateral. All those that are coming closer into the midline we call medial. 2 more points are the proximal and distal parts of the body position. Proximal is really just a description of any point that is near to the attachment of a limb. So we can use the term proximal to say that something is close to, synonym of proximal. Distal means far from. So if I was to describe the hand relative to the shoulder, I would say that the hand was distal to the shoulder. But if I was to describe the shoulder relative to the neck, I would say that the shoulder was proximal to the neck. So these terms, proximal, distal, superior, inferior, and finally lateral, medial, are the kinds of points of reference that we'll be using throughout the course.